Welcome to the Capital Integrative Health podcast, a podcast dedicated to transforming the consciousness around what it means to be healthy and understanding the root causes of both disease and wellness. I am Dr. Andrew Wong, co-founder of Capital Integrative Health, an integrative practice committed to expanding access to holistic root cause medicine to the global community. Today we are joined by Dr. Mark Davis. Mark is a naturopathic gastroenterologist here at Capital Integrative Health who specializes in inflammatory bowel disease and has clinical expertise in fecal microbiota transplantation and Helminthic therapy. He is also a former faculty in the School of Naturopathic Medicine at Maryland University of Integrative Health. Mark enjoys working with his patients to find solutions using an integrative, evidence-informed approach. Join us for a conversation about how naturopathic gastroenterology addresses gut health in conjunction with approaches like fecal microbiota transplant and Helminthic therapy. If you suffer from gut dysfunction in general, or conditions like inflammatory bowel disease specifically, don't miss this conversation. Welcome, Mark, to the podcast. Thank you so much for being on today.
It's great to be here.
Yes, and you are obviously part of Capital Integrative Health. You have your practice called IBD Specialty Clinic. Your practice, and let's talk about first your introduction to naturopathic medicine and what motivated you to pursue the ND route.
Oh, great. Yeah. So I come from a long line of doctors and nurses. My great-grandfather and my grandfather and grandmother all were educated in the University of Maryland system for the medical school and the nursing school. And my mom's a nurse and siblings are doctors. And so growing up, I always knew that's not what I want to do. Is what I thought. I was like, what they're doing, what I see my family doing is prescribing drugs and doing surgical procedures. And I was like, if I want to help people, I think I want to help people avoid that and not do that. So I thought, no way, I'm not going to do medicine. So I thought it would be the healing power of food that would help me be a healer. And so I thought I was going to be a nutritionist, and I worked at restaurants for many years. Whole foods, restaurants, vegetarian, pescatarian, sustainable seafood, all kinds of stuff. And I loved that work. But then I discovered naturopathic medicine. And when I realized there was something that could allow me to practice the art of diagnosis and assessing and treating the whole person, and still help me with my goal of helping people avoid drugs and surgery, I knew I had found the profession for me. So, and it's been a great fit for this past decade.
And then I think we said this in the intro, but you graduated from naturopathic from NUNM, National University of Naturopathic Medicine in Portland, correct?
Yep, correct. Yep.
And
great school.
And I think what did you like most about Portland? And I mean, this is a bit off topic, but we always go off topic on this podcast. So Portland versus Maryland. Let's just talk about that a little bit.
I love both places. Portland was a great fit for me in terms of the culture of outdoorsiness and whole foodsiness, and all my neighbors around me composted and rode bicycles and did other things that are good cultural fits for me. And everybody knows what a naturopathic doctor is, and these have been licensed there for 100 years. In Maryland, naturopathic doctors have been licensed for, I think, 5 years. And lots of people have never heard of what I do. And there's a great part to that too, introducing people to something new. But it's a different cultural environment. I love the social diversity of where we live in Montgomery County, way different than Portland. And I love being close to family. I've got my parents and my sister and nieces and nephews and all kinds of people right around here. And I love working at Capital Integrative Health.
Yes, we love having you here. Yes, and I believe where you live in Maryland, I believe is also a little more woodsy. It's a bit more. I know there's a strong herbalist community, etc.
Yeah, yep. We've got some nice woods
More
right in the
natural.
backyard. We like to hike in.
Nice.
Yep.
Do you ever pick mushrooms or go out looking for different
I am
turkey tail
not
or whatever?
qualified to pick mushrooms. We pick some other things. Yeah, wood sorrel and nettle and other great things that grow around here. But yeah, you really have to know what you're doing for mushrooms.
Right. It's good. Get some antihistamine tea there with the nettles.
Yeah.
Nice.
Yes.
So I think you talked a little bit about this already, but what do you enjoy most about what you do as a naturopathic gastroenterologist?
Well, I mean, I guess I love being good at what I do, like that's always gives everyone a good feeling. And so focusing in on one organ system, and especially like I do on people with inflammatory bowel disease, I feel like it allows me to get really good at assessing and treating one thing. And so I get to feel good about that. And in general, I love puzzles, and every person is truly unique, and they are their own puzzle, and their health situation is a puzzle that changes over time. And getting to work on that puzzle with them is just a joy.
Yeah, I think there's this image in the universe of like, 1,000 different diamonds and or crystals, you could say, and it's like a kaleidoscope, and that's how it's amazing working with different individuals and how unique and beautiful each one is.
Agreed.
Yeah. So, as you were mentioning, you are very good at what you do. In fact, a world-class expert in the conditions that you work with. So let's talk about that. Go into that broadly first. What conditions do you work with, especially as a naturopathic GI doctor? And then I do want to ask you a bit more generally about IBS and reflux too.
Yeah, great. So first, I want to talk about that word gastroenterologist and what it means. So in conventional medicine, when we say a gastroenterologist, at its core, it just means a doctor who focuses on helping people with gastrointestinal disease. But in practice, in conventional medicine, that means a doctor who's graduated medical school, then done a 3-year internal medicine residency, and then a 3-year gastroenterology fellowship. So that's what it means in conventional medicine. And in naturopathic medicine, we are a much smaller profession without as much infrastructure. So we're still building out a lot of that residency and fellowship type structure. So the core meaning of naturopathic gastroenterologist is the same, a naturopathic doctor who helps people with GI disease. But in terms of the fellowship, well, I'm excited to announce, I don't know if you know this, Dr. Wong, but I helped found the Gastroenterology Association of Naturopathic Physicians about 7 or 8 years ago. And I haven't been on the board of directors for a couple of years, but just this year, our fellowship project reached fruition. So in 2022, for the first time, people have been practicing or done a residency for long enough, seeing gastro patients who have cases reviewed by peers and elders in the profession, can sit for a naturopathic gastroenterology board exam, so we can be board certified fellows of the American Board of Naturopathic Gastroenterology. So I'm
Yes,
going to
that's
sit for
so
that next
exciting.
year.
Well, congrats on
Yep.
finally getting that up. And I know it's probably been, like you said, a couple years in the works. I know there are naturopathic oncologists. We have Dr. Keats here at
Yep.
CIH. Are there
Yes.
any other fellowships yet?
Yep. There's so the oncology fellowship is the
Mm-hmm.
first. There's a endocrinology fellowship. There's a
Right.
pediatric fellowship. Those are the only ones I can think. And now we have the gastro one, and
Yeah,
maybe one
that's
more.
really great to have the credentialing and the
Yeah.
infrastructure there to support the evolution of naturopathic GI. And the other thing about gastroenterology in general is it's such a broad term. Like when you think about cardiology, you think about the heart or the vessels. You think about neurology as the brain, but there's like I don't know how many organs are there in the GI tract. There's tons of,
Right.
you
There's a
know,
lot. I
right.
mean, mouth and esophagus and stomach and small intestine and large intestine and the liver and the pancreas, and there's a lot
And of course,
involved
in
in digest.
naturopathic and functional medicine, integrative medicine as well, we always think about how the gut is the root of health and can also cause a lot of disease. And that's what Hippocrates said many, many years ago, right? So,
Yep,
so the
that's very
gut's
true.
really, one of the most, if not the most important organ here, as I'm sure you would talk about.
Yeah.
Every organ's important, but certainly the gut is up there.
Yeah, absolutely. Yeah. So I have colleagues in the naturopathic gastroenterology community. Well, there's just a lot of diversity in what we treat, and even when we're working on, like we had our conference a couple of weekends ago, and one of the main lectures was gastroenterology and mental health and how those two interact. And another one was gastroenterology and autoimmune disease and how those interact. So really, the gut health does interact with every organ system in the body.
There's so much to talk about. We're definitely going to have to talk on another podcast, even though we're talking today mostly about some of your specialties. I do want to talk about irritable bowel syndrome for a second. This affects, and statistically, it says, up to 12% of the population. It's probably much more than that. But what is irritable bowel syndrome? Why is it important? And then, we think of it, of course, in the type of medicine we do in general as a label, as a more of a
Yeah.
diagnostic label rather as a root cause.
Yeah. So I often call IBS, or irritable bowel syndrome, 100 things with one name. And what it means is essentially that you have changes in bowel frequency or consistency with certain types of abdominal discomfort that lasts for at least a certain amount of time. And you talked about all the organs that go into the digestive process, and IBS can be about what's happening in your small intestine. It can be about what's happening in your large intestine. It can be about what's happening in your stomach. It can be about what's happening in your central nervous system or even with the immune system. So that type of discomfort, like you said, 12%, I've seen 20%, 1 out of 5 people as a common number. That can be caused by many, many different types of things. And therefore, there are many, many different approaches to helping somebody with that type of discomfort between dietary testing and other types of assessment, and dietary interventions and herbal interventions and probiotics. There's just a million ways to help people with IBS.
As you alluded to with the nervous system as well, the gut-brain connection, right? So in a way, we could call it irritable bowel syndrome, also potentially irritable brain syndrome, right? There's sometimes brain inflammation can cause.
Absolutely. Sometimes the best way to help somebody with IBS is to work on supporting their nervous system.
Yes, because we know the nervous system kind of downstream affects the gut too.
Absolutely. Yeah. And there's a real back and forth.
Back and forth, exactly. Bidirectional, correct. Yes, exactly. Yeah. So you are an expert in a few things, many things, but we'll list some of them here and then just kind of go through them. So we'll start with inflammatory bowel disease. Now, irritable bowel syndrome, like you said, is a diagnostic label with 100 causes, and one of those causes could be inflammatory bowel disease, which is a bit more there's some pathology involved, there's some inflammation involved, a little more serious, I would say. What is IBD, and then what are some of the root causes of IBD that you found?
So IBD stands for inflammatory bowel disease, and it's much less common. Only about 1 out of 200 people in this country has one of the 2 major types of IBD, and those are ulcerative colitis and Crohn's disease. And what they have in common is there is detectable inflammation and usually ulceration in the digestive tract. For ulcerative colitis, that's just in the colon. And for Crohn's disease, that can be anywhere in the digestive tract, from the mouth or even around the mouth, all the way through the esophagus, the stomach, the small bowel, and the large bowel, to the anus or just around the anus, and perianal disease. And there's usually a fair amount of pain involved. There's often bowel frequency, diarrhea, although occasionally there can be constipation. And there's often a fair amount of blood loss. Like I have a 7-year-old with Crohn's disease that I'm working with right now, who's going in today for a blood transfusion because she's lost so much blood through, rectally, that she just needs some additional blood in her system. So that's what IBD is. And there are a couple of other more unusual types, but we rarely see those. So ulcerative colitis and Crohn's are the major kinds. And there are some genetic links that people with certain families and certain genes have, but genes are necessary but not sufficient. So certain types of ways that we get inflamed and that our immune system can act, and that our mucus layers in our gut can be built because of our genes, can predispose us to IBD. But then we also need environmental triggers and lifestyle factors to kick us into that hyperinflammation and then to keep us there. So when we're working on treating, we can't change somebody's genes, but we can change what's going on in the microbiome and in their environment and lifestyle and how their immune system is.
So just to recap what you just said, Dr. Davis, you can have genetics that might set someone up for inflammatory bowel disease, IBD, either Crohn's or ulcerative colitis, but those genes don't necessarily have to be expressed based on the environment and lifestyle, either choices or experiences that person might have.
That's absolutely right. Yeah, people can have the genes. And in fact, everyone who has the genes since they were born. Some people, like my 7-year-old patient, start getting symptoms when they're 11 months old, like she did, or even younger. I had a patient who first started getting symptoms in her 70s, and she never had IBD symptoms before that. So it can come on at any age, although it's most common to start getting symptoms in your 20s and 30s.
So is it true that when someone gets treated with IBD, let's say, in a naturopathic way, potentially there's some epigenetics involved that the genes start to turn off and then the inflammatory genes, and that's how people get better? Or is there another mechanism there?
We think that is part of the mechanism.
Okay.
Yeah, there are a lot of mechanisms through which we help people. Tissue healing, tissue rebuilding, microbiome changing,
Yeah.
immune system calming. But epigenetics seems like it's one of those ways.
Great. So what are some of the approaches that you take when working with patients with IBD?
Well, I always tell my patients there's 5 phases of treatment. Phase number 1 is make sure you are safe in an outpatient setting. There's times when I talk with a patient and I'm like, well, it's time for us to stop talking so you can call an ambulance because you're not safe in an outpatient setting, and that's the most important thing. So that's always phase 1. Phase 2 is clinical remission, no symptoms anymore. It's easier to say than to do, and it's often a long process. But getting people to clinical remission, that's phase 2. And unfortunately, a lot of clinicians would stop there. Oh my goodness, my patients have no symptoms. I'm happy. We're done here. But for me, that's phase 2. Phase 3 is what we call serologic remission, meaning when we test biomarkers, blood tests like ESR and CRP, stool tests like fecal calprotectin and other things, when we look at those biomarkers, they're all normal. Because you can be symptom-free with elevated biomarkers, and that is evidence that you may be at increased risk of getting colon cancer down the line. If you have Crohn's, you might get narrowing, strictures, or obstructions. You can get what are called fistulae, where inflammation makes a tunnel from your intestines to the bladder or the vagina or
not
another
symptomatic,
part.
You're saying.
Even if not
The
symptomatic.
serologic positivity, the inflammation. So
That's
for
right.
fecal calprotectin, also for the things like ASCA and those type of things too?
Well, that's a good question. I don't use ASCA and PIANCA, although those levels can get larger and smaller. I don't use those as biomarkers to track inflammatory levels,
Okay.
because they're great indications of the flavor of inflammation someone is having, but not great indicators of how severe that
Severity,
inflammation
got
is.
it.
Yeah, like calprotectin is. So phase 3 is serologic remission. Phase 4 is histologic remission, which means when your gastroenterologist goes in with a colonoscope or an upper endoscope or both and takes biopsies, and the pathologist looks at the tissues, they say there is no inflammation in those tissues. Maybe there's some evidence of past inflammation, but no current inflammation. And we call that deep remission or histological remission. And it is a great prognosis for the future that you're much, much more likely to stay in remission durably if you get that deep remission. So nice. I love it when we get there.
Yeah.
That's phase 4. And then phase 5 is just maintenance, where we run some of those biomarker tests every 3 to 6 months to be able to predict a flare coming before you get symptoms and make sure we're doing whatever we need to do to
Got it. So I want to go back to that. That's really great. I mean, it does offer hope for some people with IBD, let's say, or they have IBS. They're not sure if they have IBD, inflammatory bowel disease. So back to the phase 1, just so the listeners kind of know, if someone has red flags, so to speak, red flags, it's like, okay, you need to go to the ER. This can't be an outpatient kind of thing. What are some of those kind of quote unquote red flags that you would say?
So they actually, interestingly enough, vary per individual, but some examples might be more than 10 bowel movements a day. Now I'll pause there because I've had patients having 20 or 30 bowel movements a day who say, no, this has happened to me a lot in the past. I'm not going to go to the hospital, even though I'm losing enough fluids that, I hear you telling me this could be dangerous. It isn't always dangerous, but if you're having more than 10 bowel movements a day, you need to check in with me, if I'm your doctor or whoever your doctor is, to say, am I still safe to be outpatient? Dizziness can be a sign that you've lost so much fluids that you're getting hypotensive, and that could be dangerous to your heart and other organ systems. So you need to go get some IV fluids or something else. If your hemoglobin gets low enough, and again, it's more about the rate of drop of hemoglobin than an absolute number, but below 7 is a great example of being low enough that we might be concerned and want to give you blood transfusion. Or just if your pain is a constant 8, 9, or 10 out of 10 most of the day. These are all reasons that you might need to go to the emergency room and not not
So
stay
severe
outpatient.
uncontrolled inflammation, dehydration, blood loss to the point of significant anemia might affect the heart, the vascular system, things like that. Okay. And then in
Exactly.
phase 4, which is histologic remission, I'm curious if there's statistics in the literature on, or in your own practice experience of, how many people with IBD get to that point of either, I guess, serologic or histologic remission.
That is a great question, and I actually don't know the statistics from the literature or my own practice. I would say uh, it is uncommon enough that it is a big celebration for me and my patients in my practice when we get there.
What I've found is it seems like just, as a primary care doctor with people with IBD, people like kind of go into remission a bit and then they might flare up again depending on what's happening. Maybe their
Yeah,
diet changes, stress, things like that.
absolutely true. This is a relapsing remitting disease. It,
Okay.
it comes in waves where symptoms get worse, symptoms get better. Even aside from stress or diet or other things that can trigger us, it just waxes and wanes. But that's clinical remission. That's what we're talking about symptoms.
Right.
Histological remission, once you get there, that tends to be more durable. I'm sorry, a serologic remission tends to be more durable. And then histologic remission, when we get there, and sometimes we do, that is the most durable of all.
Super. So, what are the favorite approaches in general, if you could outline for us, that you take when
Great.
working with either Crohn's or UC, and do you treat them a little differently? Just kind of curious about that.
They are a little different. Yeah, what they have in common is their inflammation of the digestive tract with ulceration, often bleeding, pain, etc. What they have different between them is ulcerative colitis is always just in the colon, and it's always contiguous, meaning the inflammation starts in the rectum and it moves without any skips up the colon. Crohn's disease, sometimes in the colon, sometimes not, sometimes part in the colon, part somewhere else, and it has what we call skip lesions. So it's not contiguous. It can be in various places, diseased tissue with healthy tissue in between. They respond differently to certain things. For example, tobacco, nicotine, very, very bad for people with Crohn's disease, but actually helps keep people with ulcerative colitis in remission, which I never recommend someone start smoking, but I have recommended they delay quitting until they get into better
Yeah,
control.
we're not advocating keeping smoking for those of you out there who are smoking, but
No,
yeah.
here's a note. I ran into a patient who had inflammatory bowel disease and associated autoimmune lung condition. And it was getting so bad, she was having to stop some of her physical activity. And her gastroenterologist said, look, this is ulcerative colitis related. I'm going to recommend you start smoking tobacco. I'd never heard of that recommendation before, but because it was a lung thing, get that nicotine in there. But she flared so bad with smoking, they changed the diagnosis to Crohn's.
Huh.
So,
Interesting.
yeah.
So it could be
Anyway,
used as a diagnostic tool, I suppose, in
possibly,
theory.
possibly
We
a
probably
little
wouldn't want
bit.
to do that, but
Yeah, but I
yeah.
don't use smoking as an intervention, but things I do use as interventions. Diet is a huge one. There are all kinds of interventional diets, including fermented foods in some cases, probiotics and prebiotics, lifestyle medicine, your habits, your exercise, your sleep. Herbal medicine is something I use a lot. Wormwood and mastic and green tea extracts and many, many other herbs, nutritional therapies, vitamin D and butyrate, which actually butyrate directly crosses through the cell membrane and affects our epigenetic. It goes right to
Nice.
the cell nucleus.
Do you
Uh,
like butyrate in supplement form or through indirectly through foods and stuff?
Both, but
Mhm.
I use it a fair amount supplementarily, giving
Mhm.
it orally in increasing doses up to 4 grams a day with my IBD patients and sometimes with IBS patients, which is another evidence informed protocol.
Yes, back to the diet for a second, because we know that nutrition is really important here with IBD. But in general, do you feel like that sort of plan is also maybe applicable to other people with gut issues too, like more of an anti-inflammatory diet?
Yes, I love like I told you before, nutrition was my first love. I worked in restaurants. I worked towards becoming a nutritionist initially before I found naturopathic medicine. So I love food as medicine, and it is so individualized. What diet will help one person? There are specialty diets like the specific carbohydrate diet, semi-vegetarian diet, autoimmune paleo diet, low to no sulfur diet, and we can guide diets by IgG or IgG4 testing. So there's so many different diets. And we can make our best guesses as to what diet will help one person. But I always tell people, we're starting you off on a diet blueprint, and we're going to individualize that for you based on exactly what's going on for you and how you respond to a therapeutic
Right,
diet.
everyone's a
So
bit unique, and also
absolutely.
maybe depend on the state of their gut, right? Isn't it true that based on the state of their gut inflammation, they might be able to tolerate more or less foods?
Oh, absolutely. You know, generally, I tell people we want to have a whole foods diet that's minimally processed in order to feed our healthy gut microbiome and have general health. But there are times when my patients with inflammatory bowel disease are so inflamed, I tell them the opposite. I want you to have a low fiber diet of highly processed foods. If you're going to have white rice, it can only be white rice. I want you to have very, very processed things in order to decrease your microbiome diversity and let your immune system calm down. So
Hmm.
it really depends on where a
So some
person is
people
at with their
would
gut health.
actually benefit from a little bit more refined starches at times, it sounds like.
Yeah, that's a
That's so
therapeutic diet.
interesting.
I mean,
Yeah,
I generally tell people you want whole foods, but there are
right.
times when I tell my IBD patients avoid whole
Like
foods
if they're in a flare or something like
in a
that.
flare. Yeah.
Got it. Where are you on curcumin and fish oil or omega-3s? How does that play a role in the therapeutic
Okay, great.
anti-inflammatories?
So, yep, big fan of curcumin, which is the primary anti-inflammatory extract of turmeric. I love whole turmeric too. And I love the safety and efficacy profile of turmeric and curcumin for patients with IBD and other things too, including autoinflammatory joint disease and
Hmm.
other things.
Turmeric
Um,
will stain your kitchen counter orange or yellow, so just be aware of that. That is one thing.
very true. I have
Yeah.
experienced that myself.
Yes.
Yeah.
And what about do you like more like eating fish or fish oil or algae oil, or where are you on that?
Yep. I definitely have used all of those interventions with people. I will say there are different amounts of fish oil that can help different individuals and people with different conditions. And in my experience and my read of the literature, for IBD patients, it is very, very high doses, like 10
Oh
grams
wow.
in a day or more. So that is a substantial commitment to fish oil. Now, fish oil has other good side benefits that sometimes we enjoy, including benefits for the heart and decreases in total cardiovascular mortality. Although you probably know there's emerging literature showing that for people with atrial fibrillation, large amounts of fish oils may actually aggravate
Mm.
atrial fibrillation.
Mm-hmm.
But in general, for cardiovascular disease, fish oil is a big benefit. So if someone can commit to those big doses, which is a 2 tablespoon dose 3 or 4 times a day, depending on the concentration
Yeah.
of the fish oil you get. So that's a lot of fish
And
oil.
then we do
Very
know we have
healthy.
some cardiovascular patients on aspirin or Plavix or something like that. They have to be, as you know, have to be careful with the interaction with meds or even other
Absolutely.
supplements that have blood thinning effects.
Yeah, yeah. So I find myself using fish oils not as much
Yeah,
because of the high doses and sometimes interactions, but
yeah,
for
yeah.
some patients, it's a great intervention.
Great, great. And certainly we know that there's for most of us have the omega-6 to 3 ratio is too high, like this whole idea of the inflammatory, aspect of fatty acid ratios.
Exactly.
Great. Well, we can also segue into. I do want to talk a little bit about gluten, and I think you have. I know you have this case that you may want to share, but where are you on gluten? And we know that this is a big topic, of course, in the certainly last 10 years. Should everyone with IBD or even IBS for that matter, and that's opening up a can of worms, no pun intended, for the next part of our talk today.
Yeah,
But in terms of gluten, where are you on gluten, and should people be eliminating or should people be eating a pizza every day?
yeah. So that is also very individualized. And I think when we look at our ancestry and different cultures throughout the world, there are cultures who have included gluten grains in traditional and whole foods oriented diet for centuries and managed to live healthfully like that. So I don't think everybody needs to exclude gluten grains from their diet. Other people have ancestral groups and they may have gotten a genetic roll of the dice that makes them inherently intolerant to gluten. And in fact, if we look at the genetics, HLA-DQ2 and HLA-DQ8, maybe about 40% of us are positive for one of those. So I think about at least 40% of us have the potential to have very strong immune reactions to gluten. Does that mean we all do? No. So I think gluten containing grains can be a good food and part of a helpful diet. But for some people, very, very important to avoid it. Can make huge differences in health through avoiding gluten. I have a dear friend and colleague, Dr. Lisa Shaver. She's a naturopathic doctor, specializes in celiac and gluten intolerance of many kinds. And she has lectured in the past on the ethics and importance of not giving a gluten avoidant diet without first ruling out celiac disease. Because if somebody doesn't eat gluten, you can't reliably test them for celiac disease. So, and then you don't know if you need to encourage their family to get tested, if they have additional risk for other autoimmune diseases, all these other things. So I test a lot of people for celiac. Sometimes even if they've been tested in the past, I say, you know what, I'm just going to test you again and make sure we're giving you the right tests. Everyone at CIH orders the right tests, but in the past, older sets of tests were ordered at other clinics. So,
right.
So I don't think gluten is a bad food, but it is definitely bad for some people, and we try and figure out who that is.
Now, are you ordering the celiac comprehensive panel plus the genetics? Like I think you do Prometheus maybe, but or is it just the celiac should be enough for most people? Panel?
Well, it depends on where the person is and if they're like really trying to give up gluten. And
Okay.
so if we order the genetics and they're negative for the genetics, they can't have celiac.
Yeah.
So it's not worth ordering the antibodies.
I see.
Yeah. So,
Right.
but if they're positive for the genetics, well, then I definitely will order the antibody.
Okay, got it. And let's talk about a little more about another of your specialties, and you are a world-class expert in something called FMT, or Fecal Microbiota Transplant. So let's talk about that, just define that. I don't know if everyone's heard of that. So what is FMT
Yeah.
and what conditions is it helpful for?
This is a passion of mine.
Yeah.
I've been working with this for over a decade and obsessed with it. Right when I graduated with my naturopathic medical degree, I bought the website fecalmicrobiota.transplantation.com because I knew I wanted to be involved with this.
Did you know, like 4 years before, like, first year ND student, did you know, like, oh, this is what? Or when did you decide?
No. I remember the moment I discovered it. I was working on a shift, trying to help out an IBD patient and trying to think what we could do to help this severely ill person. And I was scouring the literature on PubMed in the hallway at my school. And I came across these papers from, I think it was 2003 by Dr. Thomas Barodi, an Australian gastroenterologist. And he wrote about using this therapy that I'll describe, fecal microbiota transplantation, on some dozens of patients with inflammatory bowel disease and putting a large number of them into clinical remission. And the reasons behind it made so much sense to me. It blew me away. I right away knew I want to be involved with this. I want to do this.
That's incredible. That's great.
Yes. So the process is, well, here's the story, is that we all have trillions of microbes in our gut, trillions with a T. That's so many. And for some people, the lack of certain good microbes or the overabundance of certain bad ones or just an imbalance between the two can make people sick, or sometimes so sick they could die. So your gut microbiome has a lot to do with your health. And for some of those people, giving you an influx of new healthy colon bacteria can make your gut ecosystem correct again and remove some or all of the symptoms that were making you sick or sometimes very severely ill previously. And the most effective way to do that is to collect stool from a healthy screened donor. And stool is 2/3 bacteria by dry weight. So we process the stool in order to concentrate the bacterial portion, and then we administer that stool extract full of healthy colon bacteria to the sick patient, either as an enema or through a colonoscope or through capsules, or there's some other ways.
These are live bacteria, yes?
Live bacteria, and trillions of them. And the difference it can have on people's health can be profound. There's an infection called C. diff colitis that I know you're familiar with that kills tens of thousands of Americans every year. And giving antibiotics can often help the people who get this, and we give antibiotics for this. And maybe 2/3 of the time, when you give antibiotics for it, people get well and they stay well. But that leaves 1/3 of people who end up getting sicker and sicker, and in tens of thousands of people's cases, dying from it. And giving fecal transplant durably cures it at least 90% of the time.
Yeah.
At least 90%.
Just a little tangent on the C. diff. Do you ever find that the high-dose probiotics like Sac Boulardii is an alternative to the antibiotics?
So I've treated a lot of patients with C. diff, and I have found some patients with mildly active C. diff colitis who high doses of probiotics, along with berberine and a clean diet,
Okay.
can get rid of their C. diff. I've never seen that work with moderate to severely
If they're
active C. diff.
symptomatic, sometimes we'll see on, we know these DNA-based stool testing, the C. diff
Yep,
is positive, so there's some microbiome imbalances, and often it allows
yep.
the Clostridia to overgrow. For the asymptomatic patients, would you say that probiotics would be sort of the first line there? I typically
Yeah,
tend to not treat the asymptomatic patients with antibiotics anymore.
yeah, same. C. diff is an interesting microbe. There's a Canadian microbiologist, a friend and colleague of mine, who says that C. diff is kind of like teenagers at the subway stop. That if it's crowded at the subway stop and there's a lot of people, they're going to mind their manners and they're not going to do anything. But if everybody gets on the subway and leaves, which is what happens when you give some antibiotics that deplete the gut microbiome, all the adults leave, the teenagers go crazy and they're knocking over trash cans and they're spray painting and whatever and causing trouble.
So
So
all teenagers have behavior problems? Is that what we're saying?
no,
Just
no.
kidding.
But the C.
There's
diff
some
one,
well-behaved teenagers out there.
there are some.
Yeah.
I have
Oh,
a couple
good,
myself
nice.
actually. Yeah. So C. diff in tiny amounts in the right gut ecosystem can actually be not problematic. They do secrete small amounts of toxin, but your body processes it. Gut cells heal very well, and it actually is not a problem. And I don't treat it. Sometimes I will try to look at it as a sign of maybe there's a little imbalance starting and use probiotics
Yeah.
or sometimes berberine. All depends on the patient
Got it.
and what's
Okay.
going on for them. Yeah.
Great. So getting back to FMT, so this is a passion of yours. You're a world-class expert in this. You've been doing it for over 10 years now. What conditions is it helpful for? And maybe if you want to share a patient, sort of a case study,
Yeah.
success story too.
Yeah. Great. So, well, we know it works very, very well for C. diff, better than anything else that we have as a tool as clinicians. It also works very, very well for my practice focus, inflammatory bowel disease. People with ulcerative colitis, Crohn's colitis, and even Crohn's in other parts of the body can have dramatic responses. And I've used this hundreds of times with inflammatory bowel disease patients with many, many cases of good benefit. Fascinatingly, there's also emerging evidence that it can help people with certain types of neurodegenerative conditions, including multiple sclerosis and maybe Parkinson's and maybe autism spectrum disorders. And there's really, really interesting literature there, and I've seen all of those in my own practice. There are other hyperinflammatory conditions like graft versus host disease, and it can help hepatic encephalopathy and other things. And then interestingly enough, it can help many people with IBS. Like we said before, IBS is 100 things with one name. So it certainly isn't appropriate for everyone with IBS, but there are cases that I've seen get really, really great responses.
It's a big target. I have so many sub questions based on your amazing answer there. So number one is let's kind of go through some logistics of, let's say a patient has IBD, so maybe let's just say Crohn's, and maybe they don't want to go on biologics. I do want to talk about that in a minute. But if someone has IBD, Crohn's, and they want to try FMT, what's logistically the process for them doing that? Say they want to see you and talk about it.
Yep, great question. So for the past 8 years, FDA has had guidelines limiting clinicians like us to only using C. diff to treat patients. I'm sorry, to only use FMT to treat patients who have C. diff not responding to standard therapies. So you or I could only prepare or administer or prescribe C. diff or prescribe FMT for patients who have C. diff. So that's a limitation. So many patients with IBD do end up getting C. diff, but for those who don't, they can't have clinicians prepare, administer, or prescribe it for them. So it could still be very, very helpful for them. And in that case, they have two options. Option number one is go to another country where it is allowed. I've had patients travel to the United Kingdom, to the Bahamas, to Argentina, to Australia. There was a clinic in Canada for a while. So there are places that allow FMT to be used for more conditions.
Are there any advocacy or legislative work that's in the works for the U.S. to expand the scope, of FMT? Or
there is. I was on the board of directors of the Fecal Transplant Foundation, and we did some work around that. And I would say it looks like it is unlikely that FDA is going to reverse their opinion. So, despite some good advocacy work by us and other foundations, they're moving in another direction, and they're trying to get a lab-grown microbiome product to replace FMT, which is good in many ways. I'm excited to have more options and lab-grown products for my patients, but it's also frustrating in some ways because those products will have 5, 10, 20, or 30 species of microbes in there, whereas the human
Yeah,
gut,
less
you
diverse.
know,
Yeah, yeah,
100, 150 or more
yeah,
species in a given dose.
yeah.
So what will it actually be able to help and how much in the same ways? Well, we'll discover that over the next 5, 10 years.
Got
So
it.
it looks like the FDA is not going to reverse their opinion and make it more
What's the
allowable.
timeline of the lab-based kind of stool?
I'm going to say my best guess is a year from today, we
Okay.
will have an FDA approved product.
Interesting, interesting.
Yeah.
I got it. And I
Yeah.
thought it was interesting what you said about neurodegenerative disease, because that's definitely a interest and focus of mine in terms of the practice and brain health. So you said MS, Parkinson's, autism, definitely really interesting. Do you know in the case studies or literature on that, is it like a certain point in the disease process that it's more effective, or have they gotten a deep dive into that kind of
So the
details
literature
about
is
that?
too sparse. There have been 2 trials published on autism and only case studies published about MS and Parkinson's.
Okay.
Um, and so I would say we don't know yet. And looking at the literature on autism and microbiome in general, I would say no. I'm not an expert in autism, but my guess is the earlier the better. The earlier it happens, the more profound effect you could
Makes
potentially
sense.
have.
Yes.
Yeah. And with MS and Parkinson's, I'm not sure. I will say the literature is pretty clear that changes in the microbiome happens in Parkinson's up to a decade before the first symptoms start.
Yeah.
So that is really a microbiome driven disease in many
And there's the
ways.
idea of that the alpha synuclein that starts out in the gut retrogradely goes up to the brain and causes the depletion, I think, of dopamine and other chemicals. Maybe that's the idea that a lot of these neurodegenerative diseases actually start in the gut. I think
Start in the gut. Yeah, literally start in the
They
gut.
just had a basic science study that they released the results of, and that a lot of the beta amyloid protein that is found in the brain as pathologic beta amyloid plaques, it actually starts in the liver. This
Wow.
idea that retrogradely everything's kind of going up the enteric nervous system. So I think that's
Yeah.
really fascinating, but also a little
Yeah.
scary, as a lot of these things start decades before. So,
True.
looking at the gut, this is back to the prevention, the best cure is prevention, right? In a way, the
Very
best
true.
treatment is prevention. And so looking at the gut microbiome, optimizing, reducing inflammation, balancing the immune system, this may pay really big dividends down the road for even organs like the brain, which is
Absolutely.
amazing. And then where are you on, if someone coming in with IBD and they're on a biologic, let's say, like, can that person be given FMT, if they're
Oh,
if they're on
sure.
a biologic? Okay.
Yeah. I've done that dozens and
Got
dozens
it.
of times.
Awesome. Okay.
Yep.
Great. That's
Yep.
great to
Very
know.
safe.
Very
Yeah.
safe. Okay.
There was a literature review of, I think, about 150 patients with various kinds of immunocompromise, biologics, high dose steroids, HIV/AIDS, solid organ transplant, and other things. And FM2 is found to have an excellent safety profile, including 0 serious adverse events in anybody on
I
biologics.
mean, it's essentially a very, it's a therapy that does not work against the body. It works with the body because the body's used to these microbes, and really just balancing it more, it sounds like. So that's great. Uh, what's kind of been your most dramatic success story, I would say, I guess, for IBD, or you could just say, whatever you like, I guess.
Yeah,
Yeah.
yeah, there have been a lot.
Yeah.
One
Too
one
many
that
to
comes to
name. Too
mind.
many to name. Yeah.
One that comes to mind is
Yeah.
I just like his quote. It was I think 55-year-old male with about a 20-year history of ulcerative colitis. Had been on prednisone for most of 20 years. He was what's called prednisone dependent for a long time and had other side effects from that. We did FMT, and for the first time in 2 decades, he went into a medication-free clinical remission. And he called me and said, I can't believe it took me 20 years to find this. Thinking that
That's
I could have maybe done this
amazing.
20 years ago. Yeah, so that was a quote that stuck in my head and made me want to be even more of an advocate for FMT in the
Yeah,
world.
when you get those type of results and the patient's lives really changing, that's so amazing. I guess we can talk about Helminthic therapy. I know we've been talking a lot about FMT, but that's another of your interests. So Helminthic therapy, what is Helminthic therapy? For some reason, my mind always goes to helmets and Vikings and stuff like that. So
Yeah, you're not the only one. Yeah, it's Helminthic, Helminthic. Helminthic. And what a helminth is a tiny worm-like organism that lives in the guts of vertebrates. So every kind of vertebrate in the world has different types of these worm-like microorganisms. They're usually microscopic that live in the guts. And I think of them as just another kind of probiotic, another part of the gut ecosystem. Now, just like bacteria and viruses, there are kinds that can hurt you, and there are kinds that are just commensal. They don't hurt you. They hang out, or maybe they're even mutualistic. They actually benefit you.
so not everyone
They're
loitering in the subway is bad. It's what sounds
That's
like, right?
absolutely right.
Okay.
Yes. Yeah. So of course we can think of harmful bacteria,
hmm
but there are beneficial bacteria. We call this probiotics. We can think of harmful viruses, but there are actually beneficial viruses in our gut ecosystem. And there are harmful helminths, like elephantiasis, the elephant man, that's caused by a helminth. There's something called river blindness that makes hundreds of thousands of people get vision impairment every year. That's a helminth. And there are ones that hurt your livers and your kidneys. But those are the bad ones. And even the bad ones evade detection by your immune system by upregulating tolerance. And the good ones don't cause any substantial harm, and I can talk about that more specifically, while still upregulating tolerance in your body. And so the majority of patients that I see are suffering because their own immune system is wreaking havoc on them. They are not being tolerant enough of their own self. And so when you upregulate tolerance, you downregulate hyperinflammation. And so if you look at populations of wild vertebrates of any kind, fish and birds and primates and every kind of mammal, and even wild humans, the hunter-gatherer humans in Bolivia and in South Africa, all those wild type populations, about 2/3 of any given population is going to have helminths in their gut at any given point in time. They're a natural part of the vertebrate experience. And what you want is the helpful ones and not the harmful ones. And so if you have a hyperinflammatory condition and you bring helminths back into your gut ecosystem, which I've done for myself multiple times, for family members, for many, many patients, even for a colleague on stage at a talk once, if you bring those helminths back into your gut ecosystem, then you can experience sometimes dramatic downregulation of hyperinflammation.
Yeah, there's so many great just like a subtopics we could talk about here, but I think the really important thing that I want to just highlight to everyone listening that you just said really beautifully is that when the immune system is hyper vigilant, if there's loss of immune tolerance and there's hyperinflammation, you can get things like autoimmune disease. We're living right now at the time it's recording the COVID-19 pandemic. So basically there's morbidity and mortality from COVID, hyperinflammation of the lungs, and then long COVID, all these type of things. So a lot of these are caused by inflammatory cytokines and then like IL-6 and things like that, interleukin-6, but also loss of immune tolerance, I think is what's happening in a lot of cases. So a lot of chronic disease, I would say, gut, but also other diseases are caused by this loss of immune tolerance. To have some therapy like Helminthic therapy that can restore some of that immune tolerance is huge. And so I'm also kind of wanted to get back to the whole idea of playing with dirt, right? This whole idea that we should probably be gardening and like putting our hands, like not washing our hands all the
Yes.
time, although we recommend that before you eat, you wash your hands. We don't want anyone to get food poisoning or anything. But there is this idea that I believe, if you correct me if I'm wrong, Mark, but if societies and individuals and societies and communities that are living in a more ancestral type of climate or upbringing, maybe they have more exposure to the dirt and to the different helminths. They colonize the gut. They cause immune system tolerance. They have less autoimmunity. They have less sort of chronic atopy and allergy. Is that correct?
That's absolutely true. Yep. Yep. The more exposure you have to a broad diversity of microbes, including microbes associated with other animals, domesticated animals, wild animals, soil, wild plants, all of that exposure decreases autoimmune and allergic disease. There's a
Yes.
great book for anyone interested in going deep on this topic called An Epidemic of Absence, a new way of understanding autoimmune and allergic disease, by Moises Velasquez Manoff. Excellent book that goes into depth, and they talk about FMT a bit. They talk about Helminthic therapy, but mostly they talk about why it is that there's so much autoimmune and allergic disease in countries with greater economic resources today.
That's awesome. Well, I want to get back to Helminthic therapy and take a deeper dive, maybe on another podcast, because we're covering a lot of broad topics here. So
Yeah.
love to have you back for a second podcast here. I want to talk about the kind of some lifestyle recommendations you might have for people at home to support their gut health in general. Sort of a general idea. It's like someone has some gut issues, maybe some bloating, some reflux. Obviously, there's different precision medicine that we can do, but what are some of the basic things that people need to consider in terms of lifestyle practices to support their gut health?
I like what Michael Pollan had to say about food, which is eat food, not too much, mostly plants.
Yeah.
He wrote a whole book about food and nutrition, and he was like, that's the conclusions that I think we can come to. And by eat food, he meant real food. He meant whole food. And
So not macaroni and cheese, yeah?
not macaroni and cheese. Yeah.
Okay,
So
good.
the more processed your macaroni is, the more processed your cheese. I mean, those are very highly processed products.
Anyway,
And
right, right.
yeah, and so
Yeah.
he means whole foods. And so I think, I have 4 kids, and the one thing, if you ask them, what does your dad think about nutrition and what is the best thing for people, they'd say the less processed, the better in
Hmm.
general. That doesn't mean our family doesn't eat any processed
It can be
foods.
hard, especially with kids,
Well,
absolutely.
it's not just hard. It's like food is so many things. Food is health, but food is emotions, and food is
Yes.
socializing, and food
Yeah.
is, convenience. And so there's a million factors to take into place. And to me, health is freedom. And to the degree
Hmm.
to which someone can have, pizza and a beer and still feel good,
Yeah.
I celebrate that. And I have patients who are like, I never want to have pizza and a beer. And I'm like, great, I celebrate that too. But if you want to, I want to encourage your ability to achieve that freedom.
And it goes back to, I think, that ability to tolerate pizza and beer. It goes back to, in theory, the health of the gut, but also mindset too. Like, what are you eating the food for? I know we're going to have different podcasts down the line on that, and sort of intuitive eating and looking at that too. But yeah, that's great. Yeah, if you'd like to, it'd be great to talk about hemolytic therapy a little bit deeper.
I would love
Another
to.
time, it's awesome. We can also get into saffron and different things, different favorite herbs that you like
Yes.
too. But let's kind of close with some questions we ask all of our guests here on the podcast. Thank you so much, Mark, for being on here today. Do you have a morning routine, and is that affected with the 4 kids, or just kind of curious about that?
Oh yeah. Yeah, my morning routine really, really changes with the season. So in the summer, I am staying up later and I'm sleeping later and I'm eating more raw foods, and I have more outdoor exercise as
Yeah,
opposed to indoor exercise. Running in the woods near our house, etc.
nice.
Um, but right now it's getting colder. The school year just started, so a lot of our morning routines are about reestablishing that rhythm of getting up and having all the kids have their breakfast and be ready for school and getting out the door and getting myself ready for work. So,
Hmm.
yeah, and more cooked foods and warm foods and indoor exercise. So, yeah, the morning routine definitely changes throughout the
And I
year.
feel like our microbiomes are also seasonal. They probably change with our lifestyle and the temperature and the humidity and the foods we eat and all of that stuff too.
Oh,
Probably
that's
circadian
absolutely
rhythm.
true.
Great. What book or podcast are you enjoying the most right now, and what is it
Yeah.
about, and why do you like it?
Great question. Um, I just finished reading Oliver Sacks's book, Hallucinations.
Nice.
If any of your listeners don't know about Oliver Sacks, he's America's favorite neurologist author. He died about 5 years ago, but brilliant writer, brilliant doctor. The movie Awakenings with Robin Williams. Robin Williams is
Oh,
playing
got it. Yeah.
him in that movie.
Yeah.
Um, and Dr. Sachs describes the wide gamut of hallucinations that he knows about and encountered as a practicing neurologist. Everything from Charles Bonnet syndrome to Parkinson's-associated hallucinations and drug-induced hallucinations and other things. And he's just such a good writer and describes the human condition in medicine and in life just so well that I love him as a writer.
Great. I have to check that out. And then the final and most important question, what do you do every day to cultivate joy?
Oh, great question. Um, well, I have 4 kids and 3 dogs, so there's a lot of organic
A
joy
bundle of
that
joy is
comes.
right there. Yeah.
Bundles of. I mean, parenting can be frustrating and it's so much work, but so much
Yeah.
joy with that.
Yeah.
And I guess I would say just taking the time to listen to my own needs and wants is probably my biggest habit that keeps me joyful.
That's huge. Yeah. I also find that to be really, really helpful. Connecting back to the center, back to your own center. And then that's great. Thank you so much. And then how can listeners learn more about you and work with you, Dr. Davis?
Well, I'm right here at Capital Integrative Health, so calling or emailing the clinic to get an appointment, or you can read things that I've written or watch interviews with me at markdavisnd.net. That's MarkDavisND, like Nancy David, .net. And there's a section on writing and some interviews. There's a TEDx talk that I did and other
Nice.
things, so you can find out more there.
Thank you so much, Mark, for coming on today, and love to see you again on the next one.
Yep, same. Great to see you.